There is a moment most of us know. You are mid-sentence and a word you have used 1,000 times simply disappears. Or you walk into a room and stand there, genuinely unsure why you came. Or a name, someone you love, refuses to surface. And in that split second, a fear passes through you that is unlike almost any other. What if that moment has already been years in the making? Here is what I want you to understand. That moment of fear is not the problem. The problem is what was silently happening inside your brain long before that moment ever arrived. Possibly 20 years before. There is now a blood test that can detect the early biological signs of Alzheimer's disease decades before a single memory symptom appears. It exists. It is available right now. And most doctors are not ordering it. By the end of this video, you will know exactly what this test is, how it works, and what to say to get it. I want you to picture an electrical cord plugged into a wall. At the end of that cord is a lamp. Now imagine someone pulls the plug halfway out of the socket. Not all the way, just halfway. The lamp begins to flicker, but the actual problem, the loose connection, is hidden behind the wall where you cannot see it. That is Alzheimer's disease. By the time you notice the flicker, the forgotten word, the missed appointment, the name that won't come, the damage behind the wall has already been building for years. The brain changes that lead to Alzheimer's do not begin when memory fails. They begin in a preclinical stage, a silent window where the brain looks normal on the outside and feels normal to the person living in it, but is already under assault at the molecular level. Here is what is actually happening during that window. Your brain produces a protein called amyloid beta. In a healthy brain, this protein gets cleared away regularly, like a night shift cleaning crew sweeping up debris before morning. But in some people, that clearing process starts to fall behind. Amyloid beta fragments begin to clump together and stick to the spaces between neurons, particularly in the brain's connection hubs, the regions that link memory, language, and reasoning. These sticky clusters are called amyloid plaques, and their presence sets off a second problem. Inside your neurons, there is a protein called tau. Think of tau as the internal scaffolding that keeps your brain cells standing upright and communicating clearly. In a healthy neuron, tau is stable, organized, doing its job. But when amyloid plaques begin to accumulate, something changes. Extra chemical tags attach to tau, causing it to twist, tangle, and collapse. When tau tangles, the scaffolding inside the neuron breaks down. Communication between brain cells gets cut off. Neurons begin to die. And that process, quiet, invisible, relentless, moves through the brain for years before it ever shows up on a memory test. Now here is the part that matters most for you. By the time a standard cognitive evaluation catches a problem, the damage is already years old, arriving at the scene after the roof has collapsed. Standard annual physicals include nothing that looks at brain health at the molecular level. Doctors are trained to wait for functional decline, a measurable drop in memory or thinking, before they investigate. And in most cases, that means the preclinical window, the exact stretch where intervention has the greatest possible power, passes completely undetected. That is not because your doctor doesn't care. It is because the system was built to diagnose disease, not to prevent it. But there is something that changes this picture entirely. During that long preclinical window, one specific protein begins rising quietly in your bloodstream, predictably, years ahead of any symptom, and measuring it with a simple blood draw turns an invisible biological process into something you can actually act on. But if the science has been there for years, what is actually standing between this test and your doctor's order pad? That answer is less about medicine than most people expect. Let me walk you through how Alzheimer's is actually diagnosed today, because understanding this will explain everything. And as you listen, notice what is conspicuously absent from each step. Right now, in most clinics across the country, the process begins when someone notices a problem. A spouse mentions that their partner keeps repeating the same questions. A grown child notices their parent getting lost on a familiar route. The person themselves comes in and says, "Something feels off." At that point, a doctor will typically run a standard cognitive assessment, a series of questions and memory tasks that measure how the brain is functioning in that moment. If the results look concerning, the next step might be a brain scan, or, in more serious cases, a spinal tap, a procedure where a needle is inserted into the lower back to collect cerebrospinal fluid and look for biological markers of disease. Think about what this means in practical terms. We are waiting for someone to show visible symptoms before we look inside. It is like a cardiologist only checking for heart disease after a patient arrives with chest pain. By the time the pain is there, the damage is already done. The plaque has been building in the arteries for decades. The conversation about prevention is 20 years too late. The same logic applies to the brain. And yet, that is exactly how the system currently works. Your annual physical includes a blood pressure check, a cholesterol panel, maybe a blood sugar reading. None of it touches brain health at the molecular level. There is no standard screen for what is happening inside your neurons. As long as you can hold a conversation and remember your doctor's name, the assumption is that everything is fine. Which means the very window where something could actually be done about it quietly closes. And nobody in that exam room ever mentions it. There is also a quieter reason why the conversation often never starts. Buried underneath a lot of clinical inaction is a belief, rarely stated out loud but present, that there is nothing useful to do with an early Alzheimer's diagnosis anyway. If we find it early, what changes? This thinking is understandable. It comes from a genuine place. But it belongs to a different era of medicine, and I want to address it directly. Early detection matters because the brain is not a static organ. It is adaptable. It builds what we call cognitive reserve, the capacity to find alternate pathways, to compensate for damage, to stay functional longer. Exercise, sleep quality, stress management, nutrition. These things genuinely influence how the brain responds to the presence of Alzheimer's pathology. The earlier you know, the more of that reserve you can build. And now, with disease-modifying therapies becoming available, the early biological window is exactly where treatment has the most power. Knowing early is not a burden. It is a tool. But here is the reality of where we stand. Fewer than 15% of primary care physicians currently use any Alzheimer's blood biomarker test in their practice. And yet, nearly 9 out of 10 of those same physicians acknowledge that mild cognitive impairment and early Alzheimer's disease are significantly underdiagnosed in the United States. They know the problem exists. Most just do not yet have a clear path to address it. That gap is real, and it is wider than most people realize. But before we talk about how to close it, you need to understand what the test is actually measuring, because the biology behind it is what makes the numbers so hard to dismiss. Let's go back to tau protein for a moment, because understanding what tau does in a healthy brain is the key to understanding why this blood test is so significant. Think of tau as the internal scaffolding inside each of your neurons. It keeps the structure standing. It stabilizes the tiny tracts that carry nutrients and signals from one end of the brain cell to the other. When tau is healthy, those tracts hold firm. Communication flows. Neurons stay alive and connected. But in Alzheimer's disease, something happens to tau at a very specific location on the protein. Extra chemical tags, phosphate groups, attach to it in a way they are not supposed to. When those tags attach at a site called threonine 217, the tau protein changes shape. It becomes unstable. It begins to pull away from the tracks it was holding together, and instead starts clumping with other misfolded tau proteins, forming the tangles we talked about earlier. That abnormally tagged version of tau is called phosphorylated tau 217, or p-tau 217. And here is where it gets important. When this process begins inside the brain, small amounts of p-tau 217 leak out of the neurons and into the bloodstream. Not in large quantities, but enough to be measured. And what researchers have found is that this leaking starts remarkably early, long before the neurons begin to die, long before any tangle becomes visible on a scan, and far, far before a person notices any change in their memory or thinking. Picture it this way. Imagine smoke beginning to drift under a closed door. You cannot see the fire yet. The room on the other side may even feel fine. But the signal is already there, unmistakable, if you know to look for it. P-tau 217 in your blood is that smoke. Research shows that p-tau 217 levels begin rising approximately 20 years before cognitive symptoms appear, and the predictive window shifts depending on your age. If elevated p-tau 217 is detected at age 60, symptoms typically emerge around age 80. If it is detected at age 70, the window is roughly 10 to 12 years. The younger the brain at the point of detection, the more time, and the more resilience you have to work with. Now let's talk about accuracy, because this is where the science becomes genuinely difficult to ignore. When physicians diagnosed Alzheimer's using standard clinical evaluation alone, cognitive tests, patient history, clinical judgment, they were correct about 75% of the time. That sounds reasonable until you consider what the other 25% means for a real person. A missed diagnosis, a wrong diagnosis, years lost. When p-tau 217 results were added to that same clinical evaluation, diagnostic accuracy rose to over 94%. That is a 19 percentage point improvement from a single blood draw. And that level of accuracy puts it on par with PET brain imaging. Scans that cost thousands of dollars, require specialized equipment, and are available in only a fraction of medical centers. The same information, a blood draw. One more thing I want to address directly, because I hear this concern often. A positive result, elevated p-tau 217, is not a diagnosis of Alzheimer's disease. It is a signal that Alzheimer's pathology is likely present in the brain. It guides the next step. It opens a conversation with a specialist. It initiates a plan. It does not close a door. It opens one, earlier than any other tool we have ever had. And that 20-year window before symptoms? That is not a sentence. That is where hope lives. That is exactly the stretch of time where lifestyle, where treatment, where the brain's own remarkable capacity to adapt can make a real difference. So the test is accurate, it is available, and it offers a window that nothing else in standard medicine can match. Which makes the next part of this story genuinely frustrating, because there are very specific reasons most patients have never heard a word about it. I want to start here by saying something clearly. If your doctor has not mentioned this test, that is not a failure of care. It is a failure of infrastructure. And there is a meaningful difference between those two things. The physicians I know went into medicine because they want to help people. What is happening with p-tau 217 adoption is not about intention. It is about a system that was never designed to move quickly. So let me walk you through what is actually getting in the way. The first barrier is money, or more precisely, the uncertainty around it. 95% of primary care physicians cite high out-of-pocket costs and unclear insurance coverage as a major obstacle to ordering these tests. And that hesitation is not unreasonable. A doctor who orders a test their patient cannot afford, or who sends a bill that insurance unexpectedly denies, creates a different kind of harm. Until reimbursement pathways are clearer and more consistent, many physicians will wait. Not because they do not believe in the test, but because they are trying to protect their patients from an unexpected financial burden. The second barrier is training. 82% of primary care physicians report having no clear clinical guidelines on how to incorporate blood biomarker testing into their practice. Think about what that means from their perspective. A test arrives. The science looks compelling. But there is no protocol telling them when to order it, how to interpret a borderline result, or what to do next. Medicine runs on guidelines. When the guidelines are still catching up, adoption slows, even when the science is ahead. The third barrier is the hardest one to talk about, but it needs to be said. For a long time, there was a quiet belief inside medicine that an early Alzheimer's diagnosis was more of a burden than a benefit. If there is nothing to offer the patient, why open that door? I understand where that thinking came from, but it belongs to a different era. We now have lifestyle interventions with real evidence behind them. We have disease-modifying therapies entering clinical use. We have clinical trials actively recruiting people in the earliest stages, people who would never have been identified under the old model. The window before symptoms is no longer empty. It is exactly where the most meaningful action can happen. And yet, some physicians have not updated that mental model. The belief that earlier knowledge equals more suffering still influences clinical decisions in ways that are rarely spoken aloud. The fourth barrier is something that lives on the patient side of the room. 43% of physicians identify patient fear as a reason these conversations never begin. The belief that memory loss is just a normal part of aging. The reluctance to find out something you cannot unknow. I hear this from patients in my own clinic. The fear is real, and I do not dismiss it. But I have also sat across from people who wish they had known sooner, who would have made different choices, who feel that knowing earlier gave them something back rather than taking something away. The system was not built for early detection. It was built for crisis response. And changing something that large takes time. More time than your brain has to wait. Which means the most useful thing I can do right now is tell you exactly how to move forward without waiting for the system to catch up. Let me give you something concrete to walk out of this video with. There are several p-tau 217 blood tests currently available in the United States. Quest Diagnostics offers a test called AD Detect, available at thousands of patient service centers across the country. Arup Laboratories offers a validated p-tau 217 plasma test, and Roche's Alexis p-tau 181 received FDA clearance in late 2025 specifically for use in primary care, designed to help rule out Alzheimer's pathology in adults 55 and older. These are not experimental tests sitting in a research lab somewhere. They are real, they are accessible, and they are being ordered right now. When you speak with your doctor, I want you to have the exact language ready. You can say this: I'd like to discuss a plasma p-tau 217 test as part of my cognitive health screening. That phrasing matters. It signals that you are informed, that you are asking about a specific biomarker, and that you are approaching this as a proactive health decision, not a panic response to a bad day of forgetting things. Now, who should be asking for this test? If you are 55 or older, this conversation is worth having. If you have a first-degree relative, a parent or sibling, who was diagnosed with Alzheimer's disease, that family history makes the conversation more urgent. And if you have noticed any subjective changes in your own memory or thinking, even mild ones, even ones your doctor has already reassured you about, those concerns are worth taking seriously with a biological marker rather than setting aside. On cost. Blood-based testing currently runs between $500 and $1,000, which is significantly less than a PET scan and far less invasive than a spinal tap. Insurance coverage is expanding as FDA clearances increase, and because these tests now hold regulatory approval, Medicare coverage is expected to follow. If cost is a concern, ask your doctor's office directly about what your plan covers. The landscape is changing quickly, and it is worth the conversation. Here is what a result actually means in practice. A low result gives you something genuinely valuable, meaningful reassurance, grounded in biology rather than guesswork. An elevated result does not mean Alzheimer's is inevitable. It means the pathology is likely present, and that you now have time, real time, to act. That could mean a referral to a neurologist. It could mean access to a clinical trial. It could mean a serious, structured conversation about exercise, sleep, nutrition, and stress, all of which have evidence behind them for protecting cognitive reserve. The earlier you know, the more of that reserve you have left to build. Your brain is remarkably resilient, but it works best when you give it the earliest possible warning. At your next annual visit, I want you to ask one question. Can we talk about a plasma tau blood test? That is all. One sentence. You do not need to be a patient who waits for the system to come to you. You can be someone who walks in prepared, asks for what exists, and uses the answer, whatever it is, to make better decisions. Before you close this video, I need you to hear one more thing. And this one matters as much as everything we just covered. Getting the test is the right first step. And now that you are thinking clearly about your brain health, there is something working against you that most people never connect to Alzheimer's risk. Something sitting in your kitchen right now, likely on your breakfast table or in your pantry, that you are probably eating most days. There are specific foods that directly accelerate the same biological processes we just spent this entire video talking about. The amyloid buildup, the tau damage, the inflammation that drives it all forward. And they are not the foods you expect. Some of them are foods that are commonly marketed as healthy. The next video on your screen covers exactly this. I would not feel right sending you off to take action on your brain health without making sure you see it first. Because what you eat between now and that doctor's appointment can either support everything you just learned or quietly work against it. Do not let that be the thing you missed. The next video is already there. Watch it now.